Hello, everyone, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. Before we begin, I'd like to let everybody know that if you go to mcgill.ca/dementia, we have a wide variety of comprehensive resources for family caregivers, medical students, healthcare professionals, including this amazing dementia companion guide. I think it's kind of hard to see through my Zoom. That is available in 7 different languages. It has all kinds of information that could help persons living with dementia, care partners, students, everyone. It's available to download for free. I think I mentioned just now it's available in 7 different languages, or you can obtain a printed copy from Amazon with all proceeds going to our program. We also have a library of past McGill Cares webcasts, over 80 of them. They're also available on Spotify, as well as an amazing dementia activity booklet that was developed by the McGill School of Physical and Occupational Therapy, and other resources. So I encourage all of you to go and have a look at what's available, because everything is for free. So today we have a very important topic, which is called driving and dementia. We've had a lot of demand for this topic, and I'm so pleased to have my colleague and friend, Dr. Isabelle Gélinas, who is the Associate Professor and Graduate Program Director at the School of Physical and Occupational Therapy here at McGill University. She's also a researcher at the Center for Interdisciplinary Research in Rehabilitation in Montreal, and a member of the Candrive Research Team interested in driving in the elderly. She developed the Disability Assessment for Dementia, a measure of functional abilities and activities of daily living, which is used clinically and in clinical trials internationally. She's also interested in issues related to different forms of transportation, mobility, including driving, to enable community participation for adults with disability and older adults. So Professor Gélinas will speak about driving and dementia, and will identify when it's time, why it's time to stop, and some strategies that can be implemented. Welcome to McGill Cares, Isabelle.
Thank you so much for the invitation. It's a pleasure to be here and to talk about this topic, which is really close to my heart. So I'm very glad to be here.
So we've known each other actually for quite a long time. I've been fortunate to be a lecturer at the School of Physical and Occupational Therapy for many, many years. And you have had a personal experience with the illness. Would you like to share a little bit?
Yes, sure. My dad, who now passed away, did have Alzheimer's disease. So although I, as a clinician, as an occupational therapist, I did work with caregivers and persons with dementia. I also had a more personal experience going through the continuum of changes within dementia with my father. So yes, so it brings a whole other perspective when it is actually close to a personal experience. It's very different from when you're actually a clinician working with families. So I got to experience both sides.
Well, absolutely. And I'm sorry for the loss of both of your parents recently. And we're very happy to have you here today. And one of the leading experts on driving and dementia. So I'll let you take it away with your presentation.
Thank you. All right, so I'll start my presentation on driving and dementia. Just to give you a brief overview of what I will be covering, I'll first start with talking about a few facts about driving with seniors and persons with dementia. I'll talk a little bit more also about the driving task, what it involves, and what's the impact of dementia on driving. I'll discuss some warning signs and how to proceed when that happens. And also I'll spend some time talking about how to deal with or approach driving cessation. which is really something that we all need to prepare for, actually. So this is not a surprise, I think, for most of all, that driving is really a very important activity for most of us, for community participation. It's important for our quality of life. And there's been quite a few studies that have looked at the impact of driving cessation. And it's been shown to have, for some people, devastating effect. It may lead to depression. Oftentimes, it will also lead to some social isolation because the person is not able to get to the important, meaningful activities that they want to get to. So access to activity is more limited oftentimes after driving cessation. So it's a really key topic that we need to really, as healthcare professional, to focus on. And I know that for you caregivers or persons living with the disease, that it is an important concern to address. A few facts just to give you some trends in terms of driving, and I'll start with the older adults. There's been several surveys that have been conducted with seniors, and what we do find is that the automobile is really the preferred mode of transportation for most seniors. And with the increase in the aging of the population, with no surprise we will see is that the number of older drivers is increasing rapidly. And some statistics shows that in 2009, 75% of people age 65 and older had a driver's license. In the States, it was 82%. And it's estimated that at least 85% of older adults, 65 years and older, will be a driver by the year 2028, and many will continue to drive in their 80s. Now, we often wonder about crash rates in seniors or older drivers. So I'll just show you a few statistics. I'm not going to overload you with statistics, but just to show you, we'll start with the graph at the top, which represent crash rate per age group. So the lower axis here represent different age group, increasing age group. What we see is that if we look at crashes totally, is that not surprisingly, the crash rate is higher in the younger people, and we hear that oftentimes on the news because oftentimes of behavior, speed. And what we see is that the crash rates decrease with age. But this is not really a true reflection of what is happening, because crash rate is also very much linked to how many times or how often we drive. So the truer representation is this middle graph here that represent crash rate per mile or kilometers driven. And what we do see here is a U-shaped curve. So again, the younger age group has more crashes, but we see that starting age 70 and older, we do see a rise in the crashes that we see. And that's with respect to how often people drive, right? And this lower graph here represents fatalities. And we do see, again, a little bit of that U-shaped curve, and that fatalities following a crash are a little bit higher for also older drivers. And this is oftentimes really a fact related to the fact that as we age, we're more frail, and then the impact of crashes has more severe consequences. But the big message to really keep out of this middle graph is that there is an increase with age, but its increase is not due to age per se, but more to the medical conditions that are associated with the aging process. So age alone is not a determinant, but it is more when there are some medical conditions that are associated that we see that there are more increased risk of crashes. And a dementia, Alzheimer's disease, any forms of dementia do represent some of these conditions that we're concerned about and that have an impact. on the person's ability to drive and the risk for crashes as well. So a few more facts, more related to dementia and driving. In 2009, it was estimated that about 28% of Canadians aged 65 and over with a diagnosis of dementia had a driving license. But this number is, of course, increasing with the increasing number of seniors and seniors on the road. And when we look at studies looking at crash risk, we do see that there is 2 to 8 times higher crash risk for individuals that are diagnosed with the dementia. And then following the onset of a dementia, the risk of accident double every 5 years. So there's an increased crash risk for people who have dementia. Now, dementia is not a uniform condition. We have different stages, as you're well aware. And the information that we have in relation to crash risks for different stages of the disease varies. But what we do see is that there's clear evidence that individuals that are in the moderate to severe stages of dementia aren't safe to drive. The picture is not as clear for individuals who have mild dementia or mild cognitive impairment. What we do see with some of the studies is that the performance is worst for individuals who have mild cognitive impairment compared to individuals who do not. And these studies have looked at simulated driving, but also on-road driving. And there's a varying range of reported rates of on-road failure in people with mild or dementia. It varies between 12 and 48%. So in terms of the statistics, if it's more moderate to severe, really what we see is that driving is not safe. Mild to moderate is not as clear. So it's variable depending on the person's ability. So really there's a big dilemma that healthcare professionals are facing in terms of working with clients with dementia with respect to driving. And it's between promoting the client's autonomy, because we know that driving has an impact on participation and being able to go and do the activities that are meaningful for the person. But on the other end, to protect their client and other road users if the person is felt to be not medically fit to drive because of the dementia. And if we talk a little bit more specifically about driving, just to get an understanding of what driving is about, we know it's a really complex activity of daily living. It's at the top of the activities in terms of complexity. And I'm just going to show you a quick video just to illustrate. It's a little bit of the more complex routes that you're seeing here, but just to show how complex driving can be. You need to really be aware of a lot of stimulus, things happening around you. Time is of essence. You need to react quickly. So it requires actually a lot of our different skill sets that we have. So driving requires all sorts of skill set. If I start with psychomotor skills, you need to be able to have enough strength, enough range of motion to be able to push on the brake and the accelerator to turn the steering wheel. You need to have enough sensation to be able to push and know when to push on your brake or accelerator. You don't look at your feet while you drive, but you have to be able to sense the pedals so that you're able to put the right pressure on the pedal to brake or to accelerate as you wish. Sensation and perception is key. Vision, which is one of the major sensory skill that we need for driving, is where we get most of the information. That's where we get information from our driving environment. And we need to make sense of that information to be able to then cognitively to make the right decisions. And we need to have enough attention to pick out in the environment what's important and what's not important, because we can't pay attention to everything at the same time. We need to choose what's more important. I'll illustrate in a moment with a picture what I mean exactly there. But also, oftentimes you have to make judgment. If you come to an intersection with stop, four-way intersection with stops, and there's two cars coming at the same time, you need to decide, am I the one who's going to go first, or do I need to let the other one pass? If you come to a light when you need to turn left and there's no arrow, you need to make a decision, when is it safe for me to turn left at the light? So driving involves a lot of different skills, and awareness is at the center. We need to know what are our skills, what are our limitations. As I was saying earlier, aging is not alone a factor in terms of limitation for driving, but with aging, there are some changes, and I'll come to that a little bit later. And we need to be aware of those changes to adjust our driving to stay safe drivers. So it's a very complex activity, requires many, many skills, and time is of essence. It's an activity that time is important. It's a very different, for example, for getting dressed in the morning. If you get dressed and it takes you half an hour or an hour, it doesn't matter. But in driving, if you don't make the right decision at the right time, it can cause a crash. So the idea of speed and time is crucial for driving, and it's what makes it also very different from other activities that we do in our daily living. Just going to illustrate a little bit of what I was mentioning here. You're coming to an intersection. Just going to give you 1 second to think about what do you need to do here in terms of that intersection. What you can see is that there is a stop sign in the background. And for some individual, and I'll bring you closer, some individual that don't have good perception or good sensory abilities, they may not be able to pick out the stop sign from the red background here. So you need to be able to have those skills. And for some of our clients with dementia, that's one ability that is actually more limited, is to pick out that key information, the stop sign from the background. Another situation here where you're coming again to an intersection here, there is a stop sign that's partly hidden by a bus stop sign. And you need to be able in your mind to make the stop sign and recognize that there's a stop sign. So some people with dementia will have difficulty to really complete that here, to know that there is a stop sign, and you see it here a little bit closer. Same thing here in terms of decision making. You have this big truck that has flashing light, and we need to know that he may back up just in front of us and try to plan our actions to make sure that there is no crash here. So again, some decision judgment that is required in terms of the driving ability. So driving is a complex activity, but is it always demanding? And actually, it's not always a demanding task. A lot of what we do with driving is done at the subconscious level. It's done with automatic behavior. Otherwise, we would be so tired when we get back home from driving if it was constantly demanding. An example that happens oftentimes is you get from your house, a friend's house, to your home. You get back home and you don't remember that you've stopped at the stop sign, and because it's so automatic and you're so used to doing that route that you don't think about it constantly. The only thing, though, is that driving is not a routine activity, and it's often unpredictable. And that's why, even though there's a lot of automatic behavior and experience, seniors drivers are very experienced. They've been driving for many years. It's not enough. There are oftentimes situations occurring on the road, and you need to be able to use good judgment, get out of those automatic behaviors to be able to come and address whatever happens in the road in front of you. And that's what what I was mentioning before, awareness is really key. So if you see that in your loved one, for example, the person doesn't seem to be as aware of some of the changes that is occurring with the dementia, this reaction time may be slower, decision making is maybe a bit slower, or judgment. This is really key, because if you were aware that there are some of these changes occurring, then you'll be able to adjust. You may drive a little bit slower, or have more distance with the driving in front of you. But if awareness is more limited, and we know that with the disease that happens over time, then it becomes much more dangerous in terms of being able to drive. And I'll just quickly go over a few changes and what we can see on the road. And I'll start with aging, because most of our people who have dementia are also aging or older adults. So we do have those changes that are normal, that occur with aging, in addition to what we see with the dementia. And we know that there are many changes that occur with vision, with age, especially in terms of glare recovery, difficulty driving at night because it's more difficult to see in the dark. Contrast sensitivity, you have a little bit of an example here, is that as we age also, the contrast are not as prominent, and that becomes a little bit more difficult. So driving at night, driving in bad weather, for example, is more challenging. And it's oftentimes also our vision tends to become more of a tunnel vision. And so seeing what's in the periphery also becomes more difficult. Physically, we may feel weaker or more stiff in our lane. There may be some pain that we experience, and we may move more slowly. So that has also an impact on our ability to react to what's happening on the road. And then in terms of cognition, there may be more difficulty remembering things. In case of the person with dementia, orientation may be more difficult. The person may tend to get lost. So it becomes much more difficult to orient yourself, especially if there's construction and you need to deviate your normal route on the road and take alternate route to get to where you need to go to. Complex decisions becomes a little bit more difficult. Also, when there are distractions, it becomes more difficult. And the reaction time with age does slow. So we do have more difficulty reacting more quickly to different situations. So what we do see in terms of what's happening on the road is with older drivers that there are more accidents while changing lanes, which is complex. You need to look around, decide when it's a good time to change lane. Performing left unprotected turns, as I was mentioning before, you need to, if there is not an arrow at a light, then you need to really make a decision as when it's the time to turn left. If you're in traffic, for example, that's a situation where we do see more accidental drivers at intersections. So it's really more complex, and again, a lot more decision making that's happening. We do also see a tendency to run over red light or stop sign, and more difficulty, as I was mentioning, with complex decision making. There's, however, a tendency to take less risk, which is a good thing with aging. And as I was mentioning before, if you are aware of the changes that are happening, most seniors or older adults are safe drivers because they tend to take less risk. There is automatic behaviors that's acquired from past driving experience. And if you're aware of these changes, you will make some changes in your driving. You'll avoid risky situation. You'll use different strategy to compensate, like going slower, taking more distances with the car in front of you. So, but in terms of dementia, what we do see is that some of these awareness abilities are not necessarily, or are lost over time, and that's when it becomes more dangerous. And what we do see on the road in terms of drivers who have dementia is that they tend to drive more slowly, drift in adjacent lane, brake more suddenly, We do see some missed stop signs or light, but also another thing that we do see is sometimes people stopping at green light, which is even more dangerous because it's dangerous for being rear-ended. Having difficulty with left non-protected turns, lane changes, merging, all of these situations that are more complex. Getting lost is also because orientation to place, to time is often get lost over time. They tend to have more collision or near misses. We see also that they tend to get more honking because other drivers are more irritated because of what I've just mentioned before, the slow driving, the stopping, and also you'll notice, and as a caregiver, that the person needs the help of a co-pilot. So a person telling them where to go, when to turn, and which is a strategy that some people will tend to use, but it's not something we recommend. If a person needs to rely on a co-pilot, it's a sign that driving may not be safe. And it's not a strategy that should be reinforced, but more seen as a warning sign in terms of driving. So what does the Medical Association say about guidelines in terms of dementia and driving? What it says is that a diagnosis is not sufficient to remove a driving privilege because there's a continuum of changes over the disease. In the mild cases, as statistics showed, as I discussed earlier, it's not clear that a person with mild dementia cannot drive. What is clear and what the guidelines are for the Medical Association, however, is that individuals that are in the moderate to severe should not drive. And when we talk about moderate to severe, it means really not being able to perform 2 or more what we call instrumental activities of daily living. So being able to manage your finance, cook a meal, take care of your house, or if the person is not able to do any of the basic activities of daily living, so bathing, dressing, these are signs of moderate to severe dementia. While for individuals with mild dementia, it's not as clear, and then the person really needs to undergo more testing just to make sure that they're still safe to drive. So they will require what we call a comprehensive driving evaluation by a specialist, and that includes an on-road testing. And they will need to be monitored over time and reassessed on a regular period. So moderate to severe should not drive. Mild cognitive, mild dementia, there is a need for more investigation. And at this point in time, there is not the ideal test that tells you safe or not safe to drive. It's really a matter of looking at the different skills that I've mentioned earlier. So what are the abilities of the person to do in the different skills and to make a decision. And individuals with dementia and their families should be informed of the eventual need to retire. So when there is a diagnosis of dementia, doesn't mean that the person needs to stop driving now, but it's going to happen with the changes over time of the condition. So it's important to plan for that. And I'll come back to that in a few minutes. So warning signs in terms of driving, if your loved one or the person loses their way, if they're less confident in their driving skill, if you notice that other drivers get impatient, honk at the person, if the person misses stop sign or traffic lights, if the person mixes up the gas and the brake pedal, and that happens quite often, if there's problem with lane change, merging, so more complex driving situation, or if there are minor accident, traffic tickets, as I was mentioning before, if the driver needs help from a co-pilot, from the passenger, or sometimes you will see that family or friends refuse to go in the car because they're too scared. These are warning signs. And that means that in those situations, you need to do something about it. It's important to discuss the concerns with family members with the person, and to bring in whoever is important in the discussion. Sometimes it's going to be just the caregiver with the person with dementia. Sometimes it's good to have other members of the family or friends that are part of it. If you're not sure what to do, you can also consult the Alzheimer's associations. But mostly it's important to talk to your doctor or the healthcare professional that you work with. If you are concerned, it doesn't mean that there is a problem, but at least something can be done about it. As I was mentioning, there can be more testing just to make sure that everything's okay. Or if there is an issue, then you'll be taken charged, and there's going to be somebody to accompany you in that process of driving cessation. You could also consult a specialist in driving, so an occupational therapist or a certified driver rehabilitation specialist. They have the skill sets to be able to really do an in-depth assessment and to accompany you in the process, also wherever it leads in terms of the assessment, right? So the healthcare professional, they'll assess the condition, what are some of the challenges that the person have, and what may be the impact on driving. They will also discuss with you, explain what are some of these changes, what are some of the impact, and they may refer you to a driving rehabilitation specialist for a more in-depth evaluation. If they see that the situation, the skill sets are not there and it's too dangerous, they may report the person to the licensing authority if required, and they will help you and counsel you or direct you to the right resources to support you, so that community mobility is still possible, and it's still possible to get to the activities that are important. Just quickly, just to talk to you a little bit about what the screening that the healthcare professional will do. They'll ask some questions, specific question about driving. Do you have a car? Is there a valid driver's license? Is the person still driving? They'll look also at your driving habits, like why do you use your car? How often? Where do you go with your car? Who is with you? What time of day? They'll also take information on your medical history, the medication, because there are some medication we take that may have an impact on driving, and there may be some directive related to that. And then they'll look at your vision, your perception, all the skill sets that I've discussed before, just to see what are the ability of the person. And then they'll make a decision. And I just want to bring in here a resource for you. It's called the Driving and Dementia Toolkit, and it does talk about driving and dementia, the assessment process, what are some of the outcome, and some key information. So I don't know, Claire will probably make some of these resources available to you. I'll bring some more resources also in a few minutes, but that's one interesting tool about the assessment process and that you can use. And what happens once you've seen your doctor has done a screening with you? There may be 3 different routes. It's like the traffic light, if you want. If everything's good, you appear to be safe, what will happen is that you'll be followed up. So there's going to be periodic follow-up just to make sure everything is still okay. On the other end of the spectrum, the red light, if the healthcare professional or your doctor feels that you're not safe to drive, then they will notify the licensing authorities, and they will do some follow-up or direct you to the right resources to accompany you in the process. And that's when driving cessation is mandated. But there may be, from the initial screening, some uncertainty. There are some issues some skills that may impact driving, and that's when they will refer for further, more in-depth assessment. And that's when you might see an occupational therapist that does a comprehensive driving assessment, which involves an on-road evaluation. So the comprehensive assessment, there's an in-office, more in-depth testing, and then an on-road assessment in a car with a driving instructor. And that goes a little bit more in depth in terms of assessing the skills of the person in terms of driving and making a recommendation to the licensing authority. And then the licensing authority will make the final decision based on the doctor's report, the occupational therapist report, also the driving file of the person, and will communicate with you, with the person, about the final decision. So it is them that make the final decision in terms of the driving recommendation. So I'll just end up talking a little bit about driving cessation. So how to assist your loved one, or if you need to stop driving, what can be done? First of all, what's very important is to, as much as possible, plan ahead. Let's face it, we all will need to retire from driving at some point. But when there is a diagnosis of dementia, we know that with the evolution of the condition, the changes, there will be a time when the person will need to stop driving. And it's always better to plan ahead before the person stops driving. Then it's much easier than to abruptly stop driving and then deal with the consequences. So as much as possible, when there is a diagnosis, even if the person is still driving, start planning ahead. It's very important that everybody be involved, the person with dementia, the family members, and it's time to make a personal transportation plan. So collect information. What are the local transportation options? Is there public transportation, volunteers, transportation? Are you in a place where there's adapted transport? There's even taxis that can be used. So it's really to look at what are some of the services also that are available, and to become familiar and comfortable with these alternative modes of transportation. So even start using these modes of transportation, even if you're still driving, just to get used to it, learn it, and explore what can be done with family members and friends. It's, however, important not to burden family members. So I really, really want to stress that, because oftentimes that's what happens, is that the burden falls on the family. I think it's very important to use family as resources, but not only family members. So very important concern. And the other thing is to investigate activities that can be accessed through other means of transportation or other means such as the internet. For example, grocery shopping, pharmacy. You can phone in or order on the internet, have it delivered home, or maybe find activities that you like but closer to home, that maybe are walking distance. So there's different strategies that can be used. It's not because you're not driving that you can't continue to do the activities that are important to you. It's more a matter of changing maybe the way to get there, or making things or using services that are available to be able to access these services. You can create a mobility account, and there's on the CAA website, there's a calculator that shows you that, in fact, if you're going just driving around your home, it's cheaper to use a taxi than to actually own a car with, the insurance, with the change in the tire, the maintenance, the insurance, all of these costs. If you make a mobility account, you can see that taking a taxi even a couple of times a week is much cheaper. So that's something to think about, and or even to plan for that, to put aside a little bit of some funds for when you won't be able to use your car. And then, as I was mentioning before, it's always better to do it all together, the person with dementia, family members. But it is a difficult transition. And sometimes people are not willing to stop driving, and it may need to be imposed. And that's very important then, to really consult your healthcare professional, your doctor, And the doctor may make a written order to the person that they can't drive. Sometimes it may be necessary to take away the keys or to hide the car so that it's not there and the person doesn't see it. In some stages of the disease, the memory is lost, so the person will not remember, but if they see the car, then it will trigger a need to use it, or if they see the keys. So these are some strategies. It's not ideal. The ideal is when the person realize and you accompany the person in the process, but sometimes there are no, the person will still be resistant, will still want to drive even though they don't have a license anymore. And that's when these alternative can be used, such as taking the key away or removing the car. Discussing driving cessation is really a sensitive issue. A few advice that I want to leave you with is to, as I was mentioning before, it's important to initiate the dialogue. It's important to involve whoever you feel would be pertinent in the discussion, especially if the person is resistant. So it could be a healthcare professional, but it could be a significant person in friends or family member that the person respect. What is important is to discuss like the medical diagnosis, what are the directives that were mentioned, and what were the reason for that directive of stopping driving. Why has the person been told not to drive anymore? Important to demonstrate understanding, empathy, stress the positive while offering alternatives. So some of those strategies that I've mentioned about, but it's important to be supportive, offer and reaffirm conditional love and support. And support, even though there are resistance, it's to address them, but offer other alternatives. It's also important that if the conversation doesn't go well, and it may happen, that not to blame yourself. Oftentimes we take a lot of responsibility and guilt for what's happening, but a lot of it is not under our control. And it's important to realize that as a caregiver. And as I was mentioning, sometimes there's a need to take away the keys or remove the car from the visual site. And there's a website that's on this slide that will also be shared with you, where they show some videos of different types of situation of caregiver talking to their loved one with different situation where there is resistance or not resistant, and how to handle that discussion or that dialogue, which is so difficult and sensitive to have. One last resource, which is a new resource, which is called the Driving and Dementia Roadmap. It's a website, and it's been developed from different research and consultation with different people to really assist the person who has dementia, the family or caregivers, and the healthcare providers on dealing with and providing resource on making that transition from driving to non-driving. So a very useful resource also. And a lot more resources that will be shared with you if you're interested into going further into or finding or reading about driving and dementia. So I'm going to leave you with that. I hope that it's helpful. And I've also have my coordinates here. So I invite you to contact me if there are any questions or about driving and dementia. It would be a pleasure to discuss with you or to communicate with you if anybody has any questions.
Isabelle, thank you so much for this incredibly excellent, comprehensive presentation on driving. I learned so much from you today. And, if I could share a little bit of my own personal experience, in the earlier stages, I was looking at the warning signs, and some of the things that I had experienced with my mother was to neglect in terms of maintaining the car. So for example, in the wintertime, I remember her coming to visit, and not only did she not have winter tires, but her tires were bald. Like there was nothing left because she had been neglecting to take the car for regular maintenance. So she was driving in the winter on tires that couldn't get up hills. The other thing was many parking tickets. They were living in an apartment building where, you'd go into an underground garage and there were all kinds of scratches on the side of the car. And then what you had mentioned, turning at intersections, she had had 2 accidents. Fortunately, her or nobody else was injured. But I think one of the biggest challenges that families are facing is, as we know, dementia causes, or many people don't know, dementia causes another illness called anosognosia. I'll say that again, anosognosia, which means that the person who has the illness is unable to recognize that there's anything wrong with them. They are unable to make logical decisions. And so it doesn't matter how many times you may tell them that they're unable to drive or unable to do certain tasks, they will not see it. And they're not doing it on purpose, but they are just unable to see it because of the anosognosia.
Yeah,
right? So,
absolutely.
right?
Yeah,
And that's a big problem.
Sign. It's a critical sign. If somebody's not aware of these changes, and it's one of the key warning signs, definitely. I agree.
And I think you made a very important statement by saying driving is not routine. It is unpredictable.
Mm-hmm.
And so I work with many families, and, when I ask about driving, I often hear, the spouse say, oh, it's okay. They know where to go. It's only 5 minutes away. They take their car to work or they take their car to the grocery store. They know where to go. But on any given day, like you had mentioned, that route to get from A to B may change, right? May change for various reasons. Yeah. And people take that for granted.
Yeah, or there may be a kid playing around. That's not something you can predict, even though you're very familiar. And you're right, that's often a comment that family makes, or drivers also make, that only driving in their own neighborhood, but that's oftentimes where most of the accidents occur, because you're so familiar and your guards are down and you're not. So if there is a medical condition also that impacts on your ability to perceive and judge, and it increases the risks. So yes.
And I think one more point I think that's important to make is, because you're also an expert in activities of daily living, is that, when you look at the different risks of driving, I think many of those risks could even be applied to somebody who then just goes and walks on their own. So for example, as a disease evolves, many people, are walking on their own, but that I think there are many important aspects that will affect walking. For example, if you're crossing the street, to know that at a red light, you need to stop. You need to recognize signs. You need to recognize it's a stop sign, looking right, looking left, when to step off the curb. And so, I hear also a lot of families who say, oh, my husband, my wife will walk to the grocery store, walk to the park. But at some point, are they able to be safe when they're doing these tasks?
Yeah, absolutely. Yeah, there are very, very related skill sets for any mobility. If you're walking or if you're cycling, sometimes you'll have also people that use a bicycle, or absolutely.
So you have provided us with an incredible wealth of information, which I'm so grateful. We are going to be posting all of those resources. I was taking pictures and taking notes. We will have a link to everything on our website under trusted resources at mcgill.ca/dementia. And, lastly, I know the whole decision of having to remove the license of a person is a very difficult one. And like you said, you can't blame yourself. And I think it oftentimes, my mother completely resisted. And although we didn't have a choice because the doctor immediately took her license without any warning. But, it really comes down to at times tough love. And you just want to preserve the person's safety and the safety of others as well.
Absolutely. Yes.
So thank you very, very much for this presentation, which I know will be appreciated by many.
It was a pleasure. Thank you.
So just to remind everybody that McGill Cares is an initiative of the McGill Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you would like to join our mailing list to be notified about upcoming episodes of McGill Cares, as well as other important programs and resources from us, please email us at dementia@mcgill.ca. Thank you for watching.